neuropalliative care actually is more of a novel field. Palliative care came out of the hospice movement and cancer care. However, more recently, we found that patients with other neurodegenerative progressive diseases benefit from this care also. What it looks like is very patient specific, but essentially palliative care is meant to be an extra layer of support for patients, their families, and to help cater a care plan to the individual patient. When I introduce what we do to patients, I break it down into two areas. One of them is symptom management, and our patients with neurologic disease have a lot of symptoms like depression, anxiety, poor sleep, even things as simple as constipation. We try to target those things. The other space that we work in is medical decision making. Our patients, even the ones with common diagnoses, typically have unique phenotypes or what their disease looks like for them. And when we look at management of their health as a whole, sometimes that medical decision making needs to be catered to their specific needs, their specific goals. It's important that we address things like decision making sometimes earlier than we typically would in exploring patients' values and what they might want for their care while they're still able to be an active and engaged part of that conversation. So these are hard conversations, but they're also some of the most rewarding interactions that I have. We have to back up a step and we have to think about quality of life as a whole. And one thing that we know is that as people not dealing with a progressive disease, we will frequently underestimate the quality of life of someone who has significant disability or is dealing with a progressive disease. That being said, a patient early in the stage of illness may also underestimate what quality of life would be when a certain intervention takes place. For example, a patient may say, I would never want to be in a wheelchair. That's a bad quality of life. But then when they get to that point, they find that there's actually quite a bit that they still enjoy, and it actually is a good quality of life. And so part of it is actually just getting to know a patient's individual values and what's important to them, what brings them joy, and seeing how we can promote that throughout a disease process. Also revisiting these conversations as things change, because people's opinions will also change over time.